Welcome to another episode of Ingrid's World. I'm your host, Ingrid Paris-Hicklin. On this show, meet Dr. Dahiya, Director of Cellular Therapy, Leukemia, Lymphoma at the University of Maryland, Greenebaum Comprehensive Cancer Center, and Assistant Professor of Medicine in the Division of Hematology and Oncology at the University of Maryland School of Medicine. Dr. Dahiya is a triple board certified in internal medicine, hematology, and medical oncology. Welcome to the show, Dr. Dahiya. It's a pleasure to have you here. Well, tell our viewers a little bit about yourself.
Yeah, it's a pleasure to be on as well, Mrs. Hicklin. Thank you for the opportunity. So I, as you introduced, I work at University of Maryland. I'm a bone marrow transplant, cell therapy physician, oncologist who takes care of patients with primarily blood cancer, but we also take care of, or our group takes care of a variety of other cancers as well. So
Wow.
Pleasure to be on.
It's a pleasure to have you here. So, Dr. Dahiya, we're going to pause for just a second so our viewers get this 1-minute overview about the amazing work that you do there at the University of Maryland Medical Center. It explains the fact that you're actually National Cancer Institute designated comprehensive cancer center. And so we're going to see this video, and we'll pause for a second.
The letter C. It can represent a lot of things. It can also represent one of life's biggest challenges. But at the University of Maryland Greenebaum Comprehensive Cancer Center, the letter C represents new hope. Our new C represents a new recognition from the National Cancer Institute, the U.S. federal agency that funds cancer research. We are part of an elite group of fewer than 50 NCI comprehensive cancer centers nationwide that receive additional funding for cancer research and are the first to offer leading-edge treatments, giving patients a better chance of survival. Our NCI designation attracts some of the most brilliant minds in cancer who want to partner with us in making even more breakthrough discoveries in cancer research and prevention. The result? Even more life-changing clinical trials and treatment technologies and medications that make a difference on a global scale. On paper, it's just one little C, but to anyone touched by cancer, it could mean everything.
All right, that was a wonderful video. It was created by the University of Maryland Medical Center. So let's talk about cancer immunotherapy. I mean, that's really, fascinating. Talk a little bit about that.
Yeah, so cancer immunotherapy has been in the works, in development for past couple of decades at least. And in the early part of taking care of the cancer patients, we primarily relied on treating cancer with chemotherapy, radiotherapy, and then doing surgeries. Now we have ability to train our own body, our own body's own immune system to go against cancer. It's a really major step forward because we are not directly attacking the cancer. We're not attacking the cancer per se, but we are training and equipping our own cancer, our own immune system to fight the cancer. So it's a really new way of fighting cancer, has been effective in so many different conditions, and is really changing how we take care of patients with a number of cancers, not just blood cancers, but so many other tumors like lung cancer, melanoma, colon cancers, completely changing the treatment options and outcome of patients with cancer.
That's amazing. So what is CAR T-cell therapy? What is that about?
So CAR T-cell therapy is a form of cancer immunotherapy. as I mentioned, that in immunotherapy in general, what we're trying to do is we're trying to train our own body to fight the cancer. In CAR T cell therapy, we are specifically training one part of the immune system, which is called as T cell. Now, T cells are cells or small, very small cells which are circulating throughout the body. They are the cells that are responsible to mount an immune response when our body sees something that doesn't belong there. When it tries to see something foreign, the T cells are the ones that attack that foreign invader. That could be a bacteria, a virus, it could be cancer. But cancer has learned how to evade or escape or lay low and escape basically being recognized by T cell and not be killed by it. So in CAR T cell therapy specifically, we take patients' own T cells out, and it's just like a blood donation procedure. Patients go through a very minor procedure to get T cells harvested or taken out. No surgery, just T cell taken out, just like a blood donation. In the laboratory, we modify those T cells through number of editing technologies, so that now the T cell is equipped in recognizing the cancer. And so that no longer that cancer can be hidden or lay low without recognition by this important cell called T cell. Now, a simple analogy there would be of a lock and key analogy. We take T cells out and we put sort of like this key on the top of the T cell. And when we put these newly engineered or modified T cells, now called as CAR T cells or chimeric antigen receptor T cells, these modified, well-equipped T cells back into the body, just like a blood transfusion. Once they're put back in, they find their enemy, which is the cancer cells. And as I said, think of CAR T cell as T cells with sort of like a key on the top of it, and the lock is with the is at the cancer cell.
Wow.
And now when the lock and key comes together, the T cell get a signal to get activated, charged up, and to kill the target cell, which is cancer cell.
Wow.
Not that they only get activated and charged up to kill the cancer cell, they get a signal to divide. For example, commonly when we start putting in these T cells, they start at a few million cells. When you put back into the patient, it's about, let's say, 1 to 2 million per kilogram of patient's body weight. So maybe, just only 200 million cells are put in. Because they're constantly getting stimulated, and these are living drugs, these are our own cells, these are our own T cells.
It's your own cells.
God-made T cells that are put back into the patient. And upon seeing that target cell or cancer cell, and with that lock and key thing, finding the right target, these 200 million cells become 200 billion in just a matter of 3 to 4 days. And they keep on rising to 2 trillion and 200 trillion, massive amounts of expansion that happens. And they keep on expanding, keep on killing the cancer cell as it comes in their way. So it's a fairly amazing, honestly, therapy that these are living drugs able to find where they need to go, do the sort of this target attack, and grow basically in our own bodies.
I mean, it's really amazing, and my goodness. So the desired outcome, the outcome of having CAR T cell therapy, what is desired outcome?
Yeah, so that's a great question, Ingrid. The desired outcome in cancer is there are only two desired outcomes, I would say, when we are taking care of patients with cancer. One is we want to make our patients live longer, potentially get rid of the cancer. The word would be cure, to cure a patient from their cancer. That's the ultimate goal.
Yes.
Other equally important goal is to make them live better. So if a therapy can make a patient live longer, cure their cancer, or if it can make a patient's life a little better or make them live better, I think those are the two effective outcomes that one is hoping for.
My goodness.
With CAR T cell therapy, we're able to do both in almost in majority of the cancers. For example, in lymphoma, a common type of blood cancer. In leukemia, another type of blood cancer, we're able to both cure and improve patients' quality of life. In conditions like myeloma, which is a cancer of the bone marrow and bones,
Yes.
there we are able to, with the CAR T cell therapy, able to make the patients live longer
Yes.
and live better. But at this point, we're not able to cure, at least in multiple myeloma. But other conditions like lymphoma and leukemia, these therapies are curative. They can get rid of the cancer completely, improves quality of life, and they're very effective in doing that.
So, Dr. Dahiya, we have a wonderful video that the University of Maryland Medical Center prepared for us. And could you introduce this video that we're going to watch?
Absolutely. So in this video, you'll see one of our very first few patients, a lovely patient who has put himself out there and promoting this special therapy and has benefited from this therapy. And that is in that video, there's Dr. Adam Rappaport, who is the director of our transplant program and head of the division of hematology and oncology. Wonderful doctor and a wonderful leader. So it's a great video and very inspirational.
All right, viewers, you're in for really just some groundbreaking information.
I'm feeling great. I'm very active, back to work. In the meantime, I've had two grandbabies born, so I've been able to enjoy them very much. And I don't think I'd be here today if it wasn't for CAR T.
CAR T therapy is really one of the most exciting new developments in cancer therapy in general and in cancer immunotherapy specifically. At the University of Maryland Greenebaum Comprehensive Cancer Center, we've treated over 70 patients with CAR T therapy, including patients with aggressive B-cell lymphoma and patients with aggressive B-cell leukemia. CAR T therapy can actually cure acute leukemia in children and young adults, and it can cure aggressive B-cell lymphomas, which is the most common type of lymphoma. Each CAR T cell is capable of killing multiple B-cell leukemia cells or B-cell lymphoma cells. Some refer to them as serial killers.
Vital signs are stable. His eyes and nose is more than a liter positive.
In CAR T cell therapy, we collect immune cells from a patient. These cells are then genetically modified and engineered to express a new protein, a totally synthetic protein on the cell surface called a CAR, which stands for chimeric antigen receptor, which is a freak of nature. It has an antibody on the outside and signaling T cell signaling domains on the inside. And this reprogrammed cell, after it's genetically engineered, modified, is grown up and cultured and then brought back to the patient and infused.
You gave him a prescription.
Typically, patients who qualify for CAR T therapy have no other treatment options.
When I heard the cancer word, I figured my days were numbered. And to this day, I at times got to pinch myself to make sure that I am still in remission. But got got a lot of reasons to live, and I was very happy with the result.
Another aspect of our program is that it's very multifaceted. There is a strong commercial FDA-approved therapy component. There's also a major research component where we're testing new CAR T therapies. This is a technology and a platform that will be applicable to many other types of cancers, including not just blood cancers, but also solid tumors like breast cancer and lung cancer and liver cancer. We also are working on ways to reduce some of the potential side effects of CAR T therapy to make it even safer and potentially be able to do it more in the outpatient setting, not just the inpatient setting, which is primarily where we do it now.
So Dr. Dahiya, what are the present and future needs of CAR T cell therapy? What are the needs?
Yeah, so another great question, Ingrid. There are, as said, I mean, it's a fairly new therapy and very effective in conditions like leukemia, lymphoma, myeloma. And there, in those cancers, although we are able to take care of and help in number of patients, not all patients get the benefit. There are patients who do not respond. There are patients who respond, but eventually stop, the treatment start failing. I think we still need to improve our these CAR T cell therapy. There's still a lot of room for development and improvement in CAR T cell therapy, so that every patient that gets these therapies benefit from it, so that their cancer is gone completely and is cured.
Yes.
And that's why there's a lot of research being done to improve upon what we already have.
Right.
Think of the therapies that we have right now as first generation therapies. These are very first iterations of CAR T cell therapy, and they're constantly evolving. The science is moving very fast. Newer types of CAR T cell therapies are emerging, and we are with the help of lab scientists, a lot of other people like research nurses and research staff are able to offer these novel therapies or newer CAR T cell therapies to patients in need under the umbrella of what we call as clinical trial.
Wow.
So we have a lot of clinical trial options available at our center, and many other centers are offering newer therapies as well. So I encourage patients to consider enrolling in a clinical trial, because that's how we move the field forward. We got here with where we are able to offer these very groundbreaking therapies because of just tremendous courage and giving nature of the patients, and just selfless nature of the patients who volunteered on the original or earlier clinical trials, and I just encourage patients to continue to think about that and help me move the field forward, from even where we are right now.
So who's eligible to participate in a clinical trial? Is that like on the website? What's the first step?
Yeah, so it all depends on what type of disease a patient has. First, they have, I mean, as you know, and many of your viewers would know as well, that cancer is not a sort of like a monolithic disease. It's not one diagnosis. It's rather a sort of like it's a constellation of various conditions put into one. For example, lung cancer is very different from colon cancer, which is very different from lymphoma or other blood cancers. So we need to know what type of cancer a patient may have. And generally speaking, they're established first line or very well established earlier lines of therapy for majority of the cancers. And if the patient progresses on those type of therapies, they would be generally eligible for a clinical trial. But the first thing to be asking is, of course, I mean, what type of cancer do they have? Always ask a physician or oncologist about if there are any trial options. I'm a big believer that a patient gets the best care under the auspices of a clinical trial, because there you have all the you're looked after a large team. People who design these clinical trials have thought tremendously about patient safety. Generally, Food and Drug Administration, FDA, has signed off on that as well. So enrolling on a clinical trial, I feel, just enhances patient care and generally encourage patients to talk to their oncologist about trial options if available at their center.
Wow. Well, it's just pretty exciting about what you're doing and the wonderful work that actually I've had the opportunity to witness it in action. And I can just say, at the University of Maryland, you all at the medical center, you're awesome, and the groundbreaking work that you're doing. Final words, Dr. Dahiya. We're going to wrap up our interview. Any final words to our viewers who are out there listening to you?
Oh, again, thank you for the opportunity. And I would say that the biggest, we have come a long way in taking care of patients with cancer. It used to be a topic that people did not want to talk about.
True.
An earlier part of,
Right.
The cancer field, to recognition and lots of research being done, and the field is changing massively. People talk about that, will we ever have a cure for cancer? Well, we do have cure for cancer, but depends which type of cancer are we talking about. So it's nice, it's very important to know what type of disease do they have, how advanced it is, what stages it is in, and what are the options, and what's the expected outcomes. Don't be discouraged if you or your loved one has a cancer. Ask second opinion if needed, and have hope. The field is changing fast. There are lots of options available, often curative as well. But if there are no curative options, there are options where doctors can intervene and make patients feel better. So we try to always we try to cure. If we're not able to cure, we always try to comfort. So that's a goal.
Wow. Wonderful words. Wonderful words. It's a privilege to get a chance to meet you and talk with you, and equally exciting to bring this to our viewers. Thank you so much, Dr. Dahiya, for finding time to be on Ingrid's World.
It's truly an honor and pleasure. Thank you.
My inspirational quote is from Vice President Kamala Harris. There will be people who will say to you, you are out of your lane. They are burdened by only having the capacity of seeing what's always been instead of what can be. But don't let that burden you. Move forward, and I'm so glad that you are here on Ingrid's World. Thank you again, Dr. Dahiya. And don't forget to watch Ingrid's World on Facebook and follow Ingrid's World VA in Twitter and Instagram. And if you miss an episode, watch Ingrid's World on YouTube and Ingrid's World LLC on that channel. Or, ingridsworld.org, you can find me. Thanks for watching.